Kani kadiga Batisi TV, mat pidang pek yaki kubor baman kasni, belawan rasha pida ka Orange Nissan Loom Sopo near Fire Brigade Shillong, ringkat bat ka eco-friendly enterprise, ki plakot nagbenta ki jingdon kam hakasong, bat kara karong.
Kum shibenta ban ya daya jing safriang jong ka khlam jing pang coronavirus ka kanhun menteri jong ka Sorkar Jylla haka khat sau tarik unailar arajar arpo kala manjur ban Thaw ya ka state COVID cell for management and surveillance of COVID-19 haka Jylla unong aiktin ka Sorkar Meghalaya Democratic Alliance u James PK Sangma haka jing ekren bat kilat pathai kubor ulai thu bakani ka COVID-19 management unit kan kuntup ya ka state management unit ka district management unit ka kanhun ban shim ya ki sample haki southly ki entry point jong Jylla ka register kerteng ya ki brio ki barung shapok ka Jylla ka kanhun ban pek ya ki quarantine bala jiet kerpang bat ya ki corona care center ki badan haka Jylla unong aiktin ulai thokru bayakani ka COVID-19 management unit on clear da mission director jong national health mission ban pentulun ya ka jingyat bai shaprang jong kani ka jingtmu ka Sorkar Jylla.
Proposal was put up and this matter was discussed that in view of the prevailing COVID-19 pandemic situation that is in existence in the state of Meghalaya, it was felt essential to set up a state COVID cell for management and surveillance of COVID-19 in the state. This dedicated cell would place its efforts on identifying preventive measures to reduce the chances of infection. So the proposal was for the setting up of a state management unit. The proposal would consist of a state management unit, a district management unit, dedicated teams at 4 major entry points for sampling, registration of civilians entering the state, and also dedicated teams to manage the selected quarantine and the corona care centers. This was felt because the current program management unit under the National Health Mission is already overburdened with the management of the numerous central schemes. So therefore, the creation of the integrated disease surveillance program under the National Health Mission in its effort to strengthen, maintain a decentralized laboratory-based IT-enabled disease surveillance system for epidemic-prone diseases to monitor disease trends and detection and response to outbreaks in early rising phase. So the proposal was that the COVID-19 management unit would be headed by the mission director of the National Health Mission in overseeing the functioning of this cell. This COVID management unit would then have the state integrated disease surveillance program under which would be the various district integrated disease surveillance programs, and under these would be the various entry point units and also the quarantine and the corona care centers. So the roles of the CMU, which is the COVID-19 management unit, would be primarily to man the entry points for registration of all civilians entering into the state. Number 2, for data collection and data management. Number 3, to monitor disease trends. Number 4, for management of the quarantine and the corona care centers. And number 5, for detection and response to disease outbreaks. So there was a certain budgetary requirement which was placed before further consideration of the cabinet, totaling to a figure of 5 crores, 5 lakhs and 92,000 only. And this was discussed, and the cabinet has duly approved the proposal placed before it.